The James Lind Alliance is a UK-based initiative that was set up to develop a method for involving patients, carers and healthcare professionals in setting priorities for research. It's still quite an unusual concept. Generally, the research agenda is determined by researchers and by pharma, who may or may not see patients and often have very different ideas about what matters. So the JLA is about bringing in an additional set of voices, the voices of the end users of the research, to find out what's important to them. So we're doing this for occupational therapy to work out what questions people that use occupational therapy services, their families and carers, the occupational therapists themselves, what questions they want research to answer to ensure that the agenda is generating the evidence that's useful to them.
The wonderful thing about the priority setting partnership in determining research priorities is that it's very stepped, very democratic, very methodical approach to actually setting research priorities, which has been tried and tested again and again, and it works. It's important to use people who use occupational therapy services in research because they are the end users. They know whether or not it works.
It's an opportunity to unite OT researchers around common aims. In terms of having it for the profession, it's good because it means that the priority, that what gets researched isn't what researchers want, it's what the public, it's what practitioners want, it's what people on the ground want and the people who are receiving our services want.
I've been particularly looking at the new NHS long-term plan, and there is a focus on a number of things which I think are key to occupational therapy practice. One is personalised care. There's also technology and how technology can support people living with long-term conditions in the future. There is also an agenda around enabling people to live as independently as possible. And I think occupational therapy has a unique contribution to these areas.
I was part of the priority setting partnership for adult social work, which finished the end of last year. So from that perspective, what I've seen is the benefits of this process are that you start a wide-ranging conversation. You engage with a large number of people from a lot of different backgrounds, and that engagement and that discussion in itself is just really useful to make people feel part of something,